Hi everyone, this is Anna, and I'm so glad you could find time to join me today. If you're new here, hi and welcome. Thanks for joining us. And if you're a returning subscriber, as always, thank you guys. Thank you for all the inboxes. Thank you for all the love. And let's grow ourselves together. Remember, it doesn't take much. It just takes a little effort from someone, a little push from someone. And, a candle loses nothing by lighting another one. So, let's do that. Let's light up each other's candles. Look, this today's topic is essentially not really a topic. It's sort of just for me to address a lot of the questions that I see in my inbox, and a lot of you that reach out to me on WhatsApp asking about, working as a doctor in Australia. And if you're new here, I just want to let you know I am a medical doctor by profession, and I live and work here in Australia. And essentially, this YouTube was just started because of the virtue of wanting to share my life, how I did it, and so that if you're thinking about the decision, wanting to cross over, then you can know that it is actually possible. And it's actually a nice place to work with lots of job satisfaction. So, and I always joke and say the pie is too big. It's we all can get a piece, and it will still be available. So so I think the biggest question that I've seen so far that cuts across a lot of things is, can I get a job in Australia? So this is across board, from young doctors that are just currently graduating, some that are in the final years, and they're saying they know without a matter of doubt they want to ship out as soon as possible. And I've seen a few messages from older consultants as well, orthopedic surgeons, and most of the times I don't really even know how to answer such, because to be honest, I only came here on the standard pathway, which is essentially for junior doctors, and sort of I'm just working my way through to be what I want to be. Okay, so is it possible to get a job in Australia? The answer is yes, it is possible, but there is a process. If you haven't watched my other YouTube video about the process of coming to Australia, please reach out and look. You'll find that video. So it is possible to come and work in Australia, but then there's just a process. Like any other country, there's a registration process, and then there is, them going through your qualifications and seeing that you're at par. And obviously then thereafter, with a job offer, then you can cross over and come and work in Australia. So as a junior doctor, there's a pathway, which is called standard pathway. As a senior doctor or a specialist, there's a specialist pathway. And if you live in some selected countries, there's the competent pathway that you can use. So yes, it is possible to work in Australia. You just need to follow the due diligence. The next thing is, Dr. Anna, I have passed my AMC1, and do you think I can get a job with AMC1? And the answer again is yes. Okay. Remember, the standard pathway has AMC1 and AMC2. A lot of hospitals will want you to have done both AMC1, AMC2, and probably internship here is very important. And also just for visa purposes and registration purposes, I would always highly recommend have a few years of experience on board. If you could have a bit like 2 years experience on board, the better. And then that way you go ahead and, you start the process. But essentially you can get a job with AMC1. It's not a lot of hospitals that offer jobs with AMC1. So essentially when you pass your AMC1, okay, maybe let me take you back. How do you get, you will need AMC1, you will need your English, and obviously IELTS or PT or whatever it is you're doing, the English, proficiency in English test. You will need a 7 across if it's IELTS, and then you would need a job offer. I think the most tricky thing about getting a job on AMC1 is the job offer, because not many hospitals give you a job with only AMC1. But I have found people that have work rights, meaning they already have a visa that allows them to live and work in Australia, and also people that have done observership. I must say that I got my job with just AMC1 and English, but it's been a while. But I know that friends and colleagues that are getting jobs with AMC1. So it's just important to sort of strategically position yourself. If you can do an observer, because what I've found is these doctors just want to know, can you be a doctor? And I joke and say, can you speak English? And are you a team player? And most of the times, if you do observership, that's an opportunity for you to shine. It's an opportunity for you to show your capabilities. Are you reliable? Can you go out of your way? Can you offer to stay behind after hours? Remember, observership is not a paid position. You need to take care of your costs. Maybe one day I'll talk about the process of observership. And essentially, you need to go beyond, far above the, average. I always say you need to be above average to be able to show your supervisors and to be able to show that the doctors there, that you are actually a reliable doctor. Your knowledge base is intact and you can actually function really well if you are part of the team. So it's very important at that time, if you're doing an observership or if you have work rights, to go into some of these offices, knock doors and say, look, I have MC1 English, and try get yourself an interview and hopefully get that job. So it's very possible to get a job with MC1. It's just that you need to strategically position yourself. Some of the bigger hospitals, like the tertiary hospitals, may not be very open to AMC1. And that's why you will see sometimes when you Google, you'll notice that, there's some people that say IMG friendly doctors, friendly hospitals. And those are the hospitals that tend to employ IMGs. They tend to be the regional hospitals. They tend to be, some of the hospitals that have already engaged IMGs and they know they're good. So essentially, yes, you can get a job with MC1, but you need your English test and then you need a job offer. And with those three, then you can apply for registration with APRA and then hopefully start your job. Okay. And then obviously that ties up with the next question that I've been told. Do I have to do all the exams before I get a job? So that's essentially covers that. And then the next question that is commonly asked is, Dr. Anna, how can I, then get the job? What's the application process of a job? So, and I'm mainly talking about the standard pathway, which is essentially the pathway for junior doctors. So you will notice that having talked about AMC exams and then obviously your English test, and then there's the application process. So some of the applications are done in the, RMO sort of, bigger pool, like where once a year, every hospital, you apply for a job on there. But I always say the most important thing during your job application is your selection criteria and your CV. You really need to sit down and work on those two documents. Okay, and having lived back at home, most of the times you're guaranteed a job as soon as you finish internship. In this country, you have to show that you have the skills and you have the capability, and obviously you are, eligible for registration to be able to take up a job. So a selection criteria is essentially, a document that will allow you to put out, the hospital will sort of say, we need somebody, that has good communication skills. We need somebody that has the skills of an RMO. We need somebody, that, if it's a job that needs you to be in different locations, like somebody that can drive. So essentially your work, and you have to sit down and do your selection criteria, okay? You have to sit down and address every of those requirements that they need you to address. Don't be shy. I always say, do not be shy at that point in time to kind of speak highly of yourself, because remember, it's a selection criteria. Before these people meet you and give you an interview, they'll be looking at these big documents, your CV and your selection criteria, to know whether they need to invite you for an interview. So that's your time to shine. Do not be shy to say that part of your achievements is you are in charge of accident and emergency, or you are in charge of this, or during your tenure as work, you brought up change by doing 1, 2, 3, and 4. And obviously, if it's an area of difficulty and you would like me to address it, by all means, just let me know. All right. And then obviously you need to work on your CV. And remember, people, long are the days where you had one CV that applied for every station. These are the days that you have to gear your CV on the job that you're applying. Okay, if you're applying for a job in women health, King Eddie's Hospital, or a women hospital, you need to gear your CV towards the skills that will allow you to work in a women hospital. If you're applying for a job as a junior medical registrar, you need to gear your CV towards a registrar, and therefore, obviously, put out, your duties and stuff like that. Okay. And then someone asked, is it hard to get registration to work in Australia? I think I've already explained how you get the registration and stuff like that. And then I got a question about my application has taken a long time, Dr. Anna. Is that standard? Okay, so applications, and when I say application, I think they were talking about their APRA registration. So APRA is essentially the regulating body that is in charge of offering, or allowing you to practice, in Australia, whether it's on limited registration or on general registration, and then it will determine whether you're level 1 supervision, where level 1 is essentially you need to be with somebody throughout, or level 2 registration, where you can do a few things on your own, but obviously under this, the overall supervision of somebody else. So the process can take different amounts of time, to be honest, but my advice has always been, or my experience has always been, when you're putting in your registration paperwork, try and put as much as has been requested. There is always a checklist. Make sure you've ticked the checklist and make sure you've attached all the paperwork. If you've changed your name and you've taken your husband's name, put in a marriage certificate in there, tick that there has been a change in your name and attach your marriage certificate. If your names differ on your degree certificate and your passport, that's the time for you to think ahead, get an affidavit or get whatever documentation you need to prove that you are the same person. Because at the end of the day, they don't want to register somebody that's not who needs to be registered. So it's sort of just, proof, doing things to make sure that, the right person is registered. So if your registration has taken long, it's possibly because, maybe this and this is not there, or I know at some point during the COVID times, it was taking a bit longer. But the beauty of being in Australia is there will always be an email. Feel free to nicely put out an email, hi, because you get a case coordinator, a case officer. Say, there'll always be a bit of communication back and forth between them. And do not tire. If they ask for this document, attach it. If they ask for this one, attach it. Do not tire of doing that, because eventually your registration will come through as long as you provide what's needed. And I have friends whose registration have taken up to 6 months, 7 months, and eventually they've come to work. So it will happen as long as you have a job offer and you have, you've gone through your exam processes. Someone has asked, I'm a surgeon, can I get a job in Australia? Like I said, I am not the most experienced in the specialist pathway, but I do understand that the surgical fields can be quite competitive to get into. And obviously, with a specialist pathway, you need to apply directly to the specialist college and see whether your qualifications are comparable, partially comparable, or not comparable. And then obviously, depending on where you are, they will advise whether you know how to proceed. So yeah, I do know of very senior doctors that have come, that I have worked with, that essentially have been surgeons in their countries and stuff like that, but have come on the standard pathway. They've gotten their general registration and then they've geared towards either surgical assisting or tried to get into the, the formal surgical pathway all over again. So sorry, I may not have all the answers, but yeah, there are avenues essentially just to speak to the respective college and see how to proceed. And then someone asked how is the pay and how can I survive in Australia? I'm a breadwinner as a junior doctor. Can I provide for my family? How much do I need to settle in and all that? And like I always say, it's planning, by and large, yeah, you get more than, what you're probably currently getting. But essentially, everything comes down to planning yourself. Obviously, with a single salary, it's a bit harder. But look, things get better. You work through, your limited registration, then you go to your general registration. And once you get your general registration, then you open up more avenues for yourself, because general registration essentially just means you can work without close supervision. So you can take up jobs. You can take up 2 jobs. You can take up, 2 part-time jobs and 1, full-time. It's really up to you once you get your general registration. And probably when you do that, then your streams of income become more. And obviously, so that's sort of just a basic thing. Definitely you can survive, but then obviously it depends on your, family structure and what you want to do, and eventually, but yeah. It is a decent pay, to be honest. And then the last question there, I think that I want to cover, because I don't want to keep this thing too long, is what options do I have after I get my general registration? So I think for all the international medical graduates, we commonly are called IMGs. I think the biggest target for an IMG, I remember when I came to Australia, I had left quite a lot at home. I mean, I was about to start my ONG fellowship or masters, and we decided to come to Australia and all that. But so when I got here, obviously with limited registration, then general registration, and as soon as, like, you will notice every person who's a junior doctor who's starting work in Australia, their target is to get general registration. Why? Because general registration will open so many doors. It will open so many doors. So when you come and it's your first job, I will always advise, set your targets right. My biggest target is to get my general registration. Whether I have to sit down, train myself to pass my AMC2, or approach the hospitals offering work-based assessment to get your AMC2, or if you've done your MC1 and MC2, all you need is 12 months supervised practice and you get your general registration if you've gone through the required rotation successfully. After you get your general registration, it's going to open so many doors. It's going to, you can apply your permanent residence as soon as possible. You can obviously get the benefits that come with permanent residence, like, securing a home and stuff like that. You can work anywhere. You can locum, and obviously locum has better rates. You can, decide I'm going to surgically assist. You can have one job where you're doing your normal, RMO duties, but you can also decide, if you have experience in surgery, you can decide I want to be a surgical assistant. And obviously that's another way of getting in income and also obviously continuing with something that you enjoy. And then obviously then you can, there's just so many doors that open with general registration. And I would highly recommend, if you're a doctor that has recently just started in Australia, focus your mind, work hard, and just have that one goal in your mind to get your general registration. You can, after your general registration, you can apply for, the fellowship programs. You can now start positioning yourself to be either a physician, to be a general practitioner, to be a surgeon, to be an ONG, which you would never do if you don't have general registration. So I think that's what I'm able to cover today. But obviously, I always say, if you want me to address any area, or you want me to respond to you privately, I'll try if time allows. But essentially, it is possible to work here. It's a rewarding job, lots of job satisfaction, adequate income to get by. And then obviously, there are other living, other things, other benefits that I always say that come with living in a first world nation, So, thanks for being here. And thanks for sending through those questions. I hope I have answered part of your questions, and I hope if you're contemplating this journey of coming to Australia, to be encouraged that it's possible. I was in your shoes before. I did not know much. There wasn't much information out there, but I knew that this is what I wanted, and this is what I wanted, and mainly, wanted for my family as well. So do not, give up hope. Keep the hope. Keep working at it. It's gonna come through, and and you'll be on this side. Plus, I may just want a neighbor and a friend. Alrighty. Bye now. God bless. Thanks.